Time. And this interview is conducted by Dr. Laurie Brown at the Medical University of South Carolina on October 9th, 1992, where Dr. Rowland is currently chairman of the Board of Trustees, and we want to get some information from Dr. Rowland about his years as past president and apparently his whole life. So tell me, welcome. And first thing we'd like to know is sort of a little bit about your family of origin, your parents, sort of where you grew up, etc.
Laurie, I hate to admit it, and I've always hated to admit it, but I was born in Georgia.
Oh.
My mother was passing through, and I decided to arrive, so we were transients in Georgia. But I was reared in Lawrence County, South Carolina, where I went to public schools and stayed there until I went away to college.
And what about your family? Do you know where they came from? They originated? Or?
My mother's family had a King's land grant in Lawrence County, and my grandparents still lived on it when I was growing up.
Is that right?
And my father's family were also from Lawrence County.
Well, good. And so you grew up in Lawrence County?
Right.
And now where did you go to college?
I went to the University of South Carolina.
And, well, what about some of the early influence in your life? Were you at the university when you decided to become a doctor, or just how did you arrive at that conclusion, or do you know?
I'm really not sure how the transformation came about. When I went off to college, I started off in pre-dental, and was definitely interested in the medical profession, but I was interested in being a dentist. And how I got from dentistry to gynecology is an interesting transformation. I think that there were two physicians in Lawrence, Dr. Nichols and Dr. Teague. And Martin Teague was very active in the South Carolina Medical Association from Lawrence. And I think he probably influenced me more than anybody else to study medicine. Interestingly enough, also, I worked part-time in a mortuary and a funeral home in Lawrence when I was growing up. And one day, my boss there, Trask McCarson, who was a great friend, asked me if I was going to bother to go to dental school, why didn't I go to medical school? And I think that was when I first started talking about studying medicine.
Well, that's interesting. And you went to medical school here?
At the Medical College of South Carolina.
Medical College of South Carolina. And any of the professors have much influence on you in choosing a specialty or guiding you anyway in that?
Well, you know, you remember a lot of the professors that taught you, some favorably and some unfavorably, I guess. I thought about this in preparation for this interview, and I think that Billy Dennis was probably the most influential person in determining which specialty I went into. My wife was his secretary when I was in medical school, and so I got to know the obstetricians and gynecologists very closely through her, and probably Billy had more influence. He and Lawrence Hester had more influence in my decision than anybody else.
Good. But
other people, of course, Elsie Taylor and Pratt Thomas and Vince Mosley and you and Kelly McKee, a lot of the older faculty members I remember very dearly.
All right. And you, your internship and residency was served?
I did my internship in Greenville at the Greenville Hospital System, primarily because at that point in my career, I sincerely intended to be a family practitioner in a small town in South Carolina. And at that time, Greenville had an outstanding rotating internship. And I intended to go to Greenville for a year and then go into practice in upstate South Carolina.
It was interesting how you got
I had to go into the Navy as a bear climber after my internship. And I served my 2-year obligation in Columbia as a dryland sailor for the Navy as an examiner for the recruiting service. Excuse me. And during that time, I decided that I did not want to be a general practitioner, that I did want to do OBGYN, and came down to Charleston and discussed the residency program with Dr. Hester, and was about to come back to Charleston and do my residency when I was invited to be a resident in OBGYN in the Navy at Bethesda. So I went to Bethesda and did the training for 3 years, and then had to serve 3 years of payback, which I did at Camp Lejeune. I always knew I wanted to practice medicine in South Carolina, so it was just a question of where. And I looked actually at Charleston and at Greenville and in Columbia. And when my partners, John Bunch and Nat Sally, invited me to join them, that was the most attractive offer I had.
Good. And you said that your wife was secretary down there in OBGYN, Billy Dennis, when you were in your resident, when you were
I was in my medical school.
When you were in medical school. How much family did y'all have?
We have 2 children, a boy and a girl. Our son is 33 and is a late bloomer who's now at Clemson. My daughter went to medical school for about a year and called me down here. And one afternoon called me and said, "Daddy, I think I would rather be a girl." And she subsequently married a graduate of the medical university, and she now lives in Reedsville, North Carolina, where her husband practices internal medicine. She has 2 daughters, sorry, 2 grandchildren.
Yeah, 2 grandchildren. Now this is a question that's sort of difficult for me to think about answering, but you probably get it real easy. How did you get involved in, let's say, quote, organized medicine?
Well, 2 things happened to me. One, I was sent to the PSRO. When you remember the PSRO was formed as a review organization. The Medical Care Foundation then was a division of the South Carolina Medical Association to do the peer review in South Carolina, and I was sent to that organization as an OBGYN representative from the South Carolina OBGYN Society, and got involved in a committee to establish review criteria, and subsequently became chairman of the president of the Medical Care Foundation. And in that regard, I was involved in the selection of Bill Mahan, our current executive vice president of the South Carolina Medical Association, and I really give him credit for getting me involved in the South Carolina Medical Association. He encouraged me to be involved, and I subsequently became treasurer and then president of the association.
Right. Now, what were some of the issues facing medicine at that time? Do you recall some of the big issues?
The biggest issue probably at that time was tort reform. We had just entered the previous few years into the era of medical malpractice as big business, and we had made an effort in the legislature to have some kind of tort reform, and that was probably the biggest issue we had. Other issues were one that the AMA created when they recommended the registered nurse technician as a bedside caregiver, and one of the fracases I was involved in was a heated discussion with practical nurses and the nursing profession as a whole about whether we should endorse this registered care technician phenomenon. To my knowledge, there never was a registered care technician in South Carolina, but the whole program certainly got the nursing profession's attention, and I think we've got better and more nurses as a result of that fray.
Well, that was a good outcome then.
they subsequently were disenfranchised, and we got another review organization. We were beginning to hear about AIDS, and it wasn't as much of a clinical problem as it is now, but it certainly was on the horizon. The Medicare, Medicaid problem of access for patients to care was an issue, and we developed a personal care plan during my presidency. Another interesting thing that happened is the auxiliary finally came through with the medical van during this time.
Right. Well, you had a good year as president with a lot of accomplishments. Anything else you would like to mention about your presidency? Anything else that you could think of at the moment?
I think that one of the things that was the most rewarding of the entire year was the association that I had with the county medical associations. It was a busy year. My partners didn't see much of them in my office, but Bill Mayen and I were out 2 or 3 nights a week usually at one of the county medical society meetings, and it was really a delightful experience to get to see people in their own territory and to talk to them about their particular problems and to visit socially with them.
Good. Would you do anything different if you had to do that year over again under the same sort of circumstances?
I think maybe if I did it again, the only thing I might do differently would really be to set out some goals and have a goal-oriented year rather than accepting things as they came and solving them as they came. I really did not have a structure, and I didn't have a real personal goal to accomplish during this thing. I think one of the things that I accomplished that was probably the most significant of my entire year was I think I did more to improve the relationship between private practice of medicine and state associations, such as our relationship with Mike Jarrett at the DHEC and Angela Rent with the Human Health Services group. And I think that our relationship with the government agencies was better and has been better since that year.
Well, that's good. I remember that you wrote a president's page one time on Mike and Andy.
Right. And I felt very close to both of them, and of course losing Mike was a terrible loss to the state. But I felt that we had a relationship between the private practitioners and the state that we never had before. We ceased to be as adversarial, I think.
Well, now, one thing about Mike, I think that you can have a feather in your cap was him getting his degree from the college here while you were here.
Mike got his honorary degree last spring, and as you remember, he was in a wheelchair and he lost his hair from his chemotherapy. But he was proud. He was very proud of that, and I was delighted to see us honor him in that manner.
Now, since you're here as president, Tommy, sort of what have you done as far as the state association is concerned? Still sort of active and
Well, of course, Laura, I spent the next year being past president,
right.
which is as my wife says, you're like the mother of the groom. You wear beige, you keep your mouth shut, which is hard for me to do. And I've not been active with the state association as a lot of people have. The usual run of events is for you to be elected to the delegation to the AMA after your presidency. And I declined that opportunity at the time because I was currently active in the Southern Medical Association and was already in the lineup to be president of the Southern Medical Association. And of course I was on this board, the Medical University Board, which takes an awful lot of time, and aspired at that time to become chairman of this board at some point, and felt that I had more than couldn't afford the time in a busy practice to be involved
tremendous amount of time also.
I still make a living.
Not also, but now, during your year as president of the state association, would you care to say anything about any of the physicians that might have helped, might have been a big influence in the way things went for you? Any particular comment you'd like to make about that?
Well, you know, I was given credit for having a coalition with Walter Roberts. And Walt and I were given a lot more credit for having this coalition than ever existed, because we were usually, or really very frequently, on opposite poles of issues. But nevertheless, Walt was a good influence and a supportive influence. And Chris Hawk, as chairman of the Board of Trustees of the Medical Association, was a strong leader and very helpful. Dan Brake was chairman and subsequently president-elect. And Danny was also very supportive. We had a real strong leadership group during that time, and I felt really more a member of the team than as necessarily the president.
Good. Now, what do you have any other comment you'd like to make about that year as president, or anything along that line you might want to add that we haven't touched on?
I don't believe so, Laurie. I think we had a successful year. I think maybe one other thing is that through my influence at the State House that I had gained while politicking for the board membership to the Medical University, I became very close to a lot of our legislators, and I think that we, through Bill Mahon's influence and our lobbyist influence, we really became an entity at the State House. We now have a presence at the State House that's significant. When a medical issue comes up, usually the members will call on Bill Mahon and ask his advice about a bill before it leaves the committee or before it's voted on. And it's nice to be proactive rather than reactive. And I think that maybe I contributed to some degree to that relationship, which is certainly more favorable than it had been before.
Well, if I can comment about that, I think that's a tremendous advancement, really. Being able to get to the legislators and talk to them and know them and have them ask for advice. What now do you think might be in your mind, the main issues facing medicine now, today?
Of course, the main issue today is who's going to be elected president next month, I think. And that might have great influence on what happens. But when I gave my inauguration address to the Medical Association when I became president, my issue was for doctors to be physicians instead of providers. And I see us moving more into the role of being providers than I like to see it go. I hate to think that you can simply put a CPT code on everything that physicians do and bill for everything they do and expect a third party to pay for everything we do. Somehow we've got to get the humanitarian aspect of being a physician back into the profession. And I really see a problem of us maintaining ourselves as professionals if we're going to be, quote, providers and just offer our services for a fee. I'm afraid that the goose that laid the golden egg may have been killed in this fracas, and I think that one day when all the HMOs have failed and all the organized medical plans have failed and somebody's rummaging around in the basement of the Capitol building in Washington, they're going to say, oh, private practice of medicine, that might be a good thing to work out. And
Never
gonna be a low ebb in the practice, in the profession of medicine.
Well, you're still optimistic.
I try to be. I still practice, and I still try to be optimistic, and I hope that we, and I think we at the medical university have to be responsible for the philosophy that our graduates have to some degree, and I hope that we can turn the tide and turn out more family practitioners and primary care physicians, and motivate our students some way so that they're not interested in doing residencies in orthopedic surgery and ophthalmology and the high-paying specialties particularly.
Right.
I don't think that the Harvard plan of relative values is really necessarily a real relative value scheme. I think that the people the primary contact patients have has to be more important than we're making. We've really become organ doctors instead of physicians, I think.
Maybe I shouldn't, but I have to agree with you that you're right. Organ doctors is a good description, I think.
And people don't understand that. They don't understand why you can't be a gynecologist and a dermatologist and a psychiatrist at the same time.
Now, how do you spend most of your time now? I know you're busy practicing. Sort of what else? Any hobbies or?
I like to hunt and fish, and I like to try to play golf. And we've built a home at the beach, and we try to go down there, and that's just by owning it. Seems like it rains every time I go down there, but I really stay busy. I'm involved with, as I said, with the Southern Medical Association, and I'll be president of the Southern Medical Association this next month for a year, and I've been involved with the American College of OBGYN on a national level, and of course the medical university takes plenty of time.
Sure.
So I'm not bored.
Is there anything else you think you might want to leave for posterity with the state association?
I don't know that I want to leave anything to posterity, but I would like to say that being elected president of the state association was really probably it was without any question the highest honor I've had in my lifetime, and it was a pleasure to serve, and it's an experience that not very many people can have, and I'm just proud to have been one of them.
That's great. Well, I want to thank you for this interview, and on behalf of the state association, and it's just nice to sit down and talk to you, an almost classmate. And one more question. Would you do it all over again?
I would be honored to do it again.
Thank you very much, Dr. Rowland.
Thank you, Laura.